Hello everyone, my name is Deeb Omari and I am an MD candidate for the class of 2023 at Indiana University School of Medicine. Today I will be discussing some of the differences between the pediatric and adult airway. One of the first things we can discuss is head positioning. In pediatric patients, the head is larger relative to body size. Younger children also have larger tongues with shorter mandibles and a prominent occiput, all of which can predispose children to airway obstruction. Infants and children younger than 2 years old may need a shoulder roll or pillow under the occiput in order to be in sniffing position. As you can see on the images on the right, the airway is easily obstructed due to the larger tongue, but placing a shoulder roll or a pillow under the occiput can help solve this issue. Next, we can talk about the larynx. In children, the larynx is actually positioned higher than in adults. The cricoid cartilage, or the ring of cartilage that's located at the inferior aspect of the larynx, changes positioning with age. At birth, it's located at the level of the C4 vertebrae. At age 6, it's located at the C5 vertebrae, and as an adult, it's located at the level of the C6 vertebrae, and that is shown on the diagram at the right. An interesting discussion point is the narrowest part of the airway. It is commonly believed that the pediatric airway is funnel-shaped with its narrowest point being at the level of the cricoid. However, more recent MRI and bronchoscopic data show that the pediatric airway is cylindrical and is narrowest at the glottis. However, the relatively non-distensible cricoid cartilage may still lead to it actually being the functionally narrowest part of the airway. Finally, we can discuss some differences with the epiglottis. In infants, the epiglottis is omega-shaped, softer, floppy, and longer. It can also be less in line with the trachea. The Miller blade can be useful in assisting to directly lift the epiglottis in order to gain a better view of the airway, and in adults the epiglottis is flatter and stiff. As you can see on the image on the bottom left, you can see the omega shape in a pediatric epiglottis, and the middle image shows the difference between a flatter, more stiff adult epiglottis and the omega-shaped pediatric epiglottis. Here are my references. Thank you for your time.